So some of you are interested in some of the conditions that we have seen that are what we would call lineage imprint diseases or conditions. And some of you have asked a little bit about low birth weight and also about a condition called hyperemesis gravidarum. So I want to touch back into what we learned earlier about when a mother actually has some type of trauma that she's unable to clear. Let's just say it has to do with like PTSD, right? And so with that, if mom is still holding that and it's affected what we call our endocrine system, specifically hormones, right? So any of those like glands that govern the hormonal system, that could be the pineal gland, the pituitary, the hypothalamus, you've probably heard of all those, and also the thyroid, and even our reproductive organs. So what can happen is if mom is still carrying that remembrance or that signature of that trauma and it hasn't been cleared, there's still a message within that endocrine system, kind of like stranger danger. And so that gets propagated on. Well, what we have found is that for some women who have severe trauma, and that could be trauma that is from natural disasters or also, unfortunately, a human disaster, which could be even abuse, including things like sexual abuse. Some women will have a harder time with their endocrine system. Makes sense, right? And so in some cases, we may have issues with infertility, where they're having a hard time getting pregnant. We might have issues where they're having a harder time with their menstrual cycle, maybe they're skipping menstrual cycles, right? And that could also lead to infertility. Or they are actually having more frequent cycles or just really painful cycles, really heavy cycles. And so with that, we also find that women who do happen to get pregnant, if they do have a really significant trauma that hasn't been cleared, it could have been adverse childhood events, and as you know, that's equal to PTSD within the literature, or they have PTSD. And if it stays with them, they may have a condition called hyperemesis gravidarum. And basically that is where a mom, while she's pregnant, is having a very hard time. She's struggling with nausea, she's struggling with keeping food down. And again, that can happen for some women, but this is different. This is much more intense, where sometimes it is so serious that they cannot keep their blood sugar stable. They can also have a really hard time with keeping any type of fluids down, and they have to go to the hospital. And basically they're just rapidly or more consistently vomiting, and they can't keep that food down. Well, that's a problem for her, of course, and then also for the nutrition of the child. And so we have to get this under control very, very quickly. And in many cases, it can include going to the hospital, getting IV fluids, getting certain type of medication that the women can be on. But this can be an indicator that the trauma is still needing to be cleared or transmuted, as we would call it. And so this is where I would love for some of my women to, if if this is something that you're dealing with right now, of course you want to make sure you're talking to your OBGYN, your regular doctors, that kind of thing, but also that you have the right support that you need, especially maybe around counseling or even EMDR or anything that you find in your community and seems to align with you. But we want to make sure that we give you the support that you need. And there's, of course, a lot of other things within conventional medicine and also within natural medicine that can be done to try to help with this. I mean, even acupuncture is used for this. Even in some of the research, even just one needle can actually be helpful for women that are suffering from this. But we want to make sure that we are, throughout the pregnancy, really helping mom to where things stay more stable so that, again, she can have a healthy pregnancy, that the child also isn't under that high stress. And so that basically when we think about like low birth weight, we've learned, right, that low birth weight is associated also with lineage trauma. So we want to try to make sure that the baby has all the support that it needs. So I just wanted to touch on that because that did get raised in one of our questions, and it's a condition that I've seen a number of times, and actually many times, and it works best when we're doing it in collaborative care with their OBGYN, and of course also other providers, including their primary care, and then also sometimes some specialists. So just wanted to share that with you. I hope that you're doing well. If you have any questions, feel free to reach out to us. We always love to hear from you. Take care. Have an awesome day.